was a trainee counsellor with us, I believe.
Yes.
Then she was a counsellor for many years, then she was a clinical supervisor, then she was a trustee, and finally, until recently, she was our chair. So she really encapsulates a couple of decades there of the progression of the counselling world. And one of the main fault lines of that progression for an organisation like Signpost and maybe elsewhere is that the prevailing wisdom is that short-term, 6 sessions, 12 sessions if you're lucky, is all that's necessary for a counselling relationship. As John suggested at the beginning, there are circumstances where that really doesn't work. So, given that we currently operate in a world of limited resources where the prevailing wisdom is as I describe, how do we work with those two demands? The demands to deliver short-term interventions and the demand of the young people, in our case, to have longer than is available. Over to Rayna.
Hello everybody. I'm not going to be able to answer that question that William's just put to me. I don't think it's a very easy answer as to whether long or short-term therapy is better, and I can't solve the political issues around it and the resource issues, and it's all driven by resources. When I first started Signpost, actually, we did long-term therapy. We had brief therapy for young people for 2 years, which was wonderful. It was a wonderful luxury. No longer is that the case anywhere. I don't think it's a terribly bad thing in some ways, and I'm going to say something about the short-term advantages as well as the long-term advantages of therapy, and that includes counselling and psychotherapy. Short-term therapy, one of the obvious things is it's cost-effective, that you can see a lot more people, and the time, in fact, if you only give them a few sessions, then your turnover is going to be much greater. And given that 1 in 4 people have a mental health issue, you can see that you have to get around quite a few people, and young people and adults, who need our help. So there is a great needs-driven society here. We have very limited resources. Funding is getting tighter and tighter. How do we provide young people with what they need? So it's time effective, cost effective. You can see more people. And one of the other advantages, and I don't think it matters whether you work long or short term, I think short term helps us in this. I like long term therapy, but short term makes us focus. It makes the therapist focus. It makes the client focus. We have explicit goals to work towards. When we're doing long-term therapy, we also have goals. We should have goals, but we hold them loosely. We deal with more than a couple of foci. We can draw themes together. We can leave a theme for a bit, come back to it. It's a more holistic way of working, but it takes a lot longer to do that. I think we can, even as long-term therapists, be disciplined by the need to have some goals to which to work. The downside of that, of course, is that if you only have a short number of sessions, you can't deal with very many foci and many themes. You might be able to deal with 1. You may be able to deal with 2. If you have 4 sessions, you can clearly only really deal with 1. If you have up to 12 sessions, maybe you'll cover some more ground. So that is one of the disadvantages, is the length of time. But we all need to learn to work to the length of time we've got, and I think we do that. The results are measurable in short-term therapy much more easily, really, than long-term therapy. We have goals, and we can measure those. We can also evaluate them. The client knows that they've achieved, the counsellor knows they've achieved, and we all can feel happy about that. So that's one of the reasons that people say that it's a good thing to do. The fact that you only deal with 1 theme and you've got lots of other themes or symptoms to deal with, that's another matter. Short-term therapy helps people cope in the present. People do have to function in the world. When I do long-term therapy, I also help people function in the present. So I incorporate short-term into long-term therapy in that way, and you can do that. But helping people to function and sending them off with strategies is the best way in the sense of getting through people. And as I say, the resources are there. We can't do a lot more than that sometimes. If a client wants to carry on, then they could possibly go privately if they've got the money. Very often they haven't, but they have a taste with short-term therapy as to whether they want to carry on or not. How they do, that's another matter. It's not easy if you can't afford it, because agencies and even schools can't really cope with too many long-term clients. Another thing about that with young people, not all young people want to work long-term. They sometimes have short-term issues. They just need a few strategies. And even if they do have deep traumas, I've had girls with the death of a parent or suicide of a parent. It's often too painful to deal with when they're very young. And even if, as in one case, a parent came to me and said, I want my daughter to be able to deal with the suicide of her father, she doesn't know that he's committed suicide, she thinks it's an accident. The girl herself, and she was only 10 at the time, she's now 12, she doesn't want to deal with it. She doesn't want to talk about it. She needs to talk about other things that are more important to her. So not all young people are going to want to work long term on their past and on their problems. If we work short term, so we have a time limited work, it avoids the collusion that can happen between the counsellor and the client. And as a counsellor, often we work from a mother transference, so we become the mother to the child. The child can get dependent. And our job as the therapist is to separate. Both we separate and the child, as in the client, separates. It doesn't always happen when you work long term. There's a danger of collusion. There's a danger of keeping the client longer than you need to keep them. Short term therapy focuses us and it prevents us from doing that. The sessions can sometimes be spaced out, and a 12-session period could have periods in between where the client goes off and does some work and then comes back and does a bit more and does a bit more. So the 12 sessions can be elongated. That's very difficult in an agency setting. It's difficult in a school setting. You have too many children and young people to deal with, and how do you fit them into the gaps? And how do you fit the other one back again when you've got certain times for the other clients? It's easier in a school setting. In my school, clients come when they want. So they may not come, so the other one can come back in that week. So that's a bit easier for them. As far as short-term therapy is concerned, we often think about CBT nowadays, and we often think about mindfulness as well. It's not the only therapy you can do short-term. Obviously, if you've only got 4 sessions, you're going to work a bit differently from 12. But in 12 sessions, you can use your own orientation if you're skillful. You can use strategy work, which can be CBT, and you can still work a little bit on the deeper issues with your own orientation. But of course it has to be limited and it has to be focused. So there are possibilities. And the downside also of short-term therapy is that the therapists can be under pressure. So if you're in an agency and you have to produce results and you have to prove that your therapy is effective, then obviously you're going to be under pressure to achieve the goals, and you're not going to be relaxed like you are in long-term therapy. I'm going to turn more to the long-term therapy because obviously it sounds very, very biased towards short-term therapy at the moment. A report was published in 2008 in the Journal of the American Medical Association, and it concluded that patients with complex mental disorders who completed long-term psychoanalytic psychotherapy were better off than 96% of patients in comparison groups. Complex mental disorders include personality disorders, which can't be diagnosed until the age of 18, chronic mental disorders lasting at least a year, complex depressive or anxiety disorders, or those with more than 2 mental disorders. So long-term therapy in those circumstances and in other circumstances is necessary for some issues. A lot of our work needs to be preventative so that we don't get to that stage. Almost half of mental disorders are diagnosable before the age of 14. So if we do some work early on, then we hope that we're not going to get those comorbid complex disorders. Long-term advantages. There are more sustained changes, I feel, in long-term therapy. If you take into account what I said about the focus and you learn from short-term therapy, then you can achieve a lot in a longer-term therapy. But what is long-term therapy? For some psychoanalytic psychotherapists, it could be up to 20 years. Some people say, yeah, it's a long time. So, I've got a client that I've had for about 7 or 8 years with a borderline personality disorder who's done brilliantly. And it's really more maintenance now. So you have to know, I think, as a therapist, what you're doing long term. If there's more sustainable growth in the client, a deeper transformation, then in a way, it's more cost effective in the long run. If you have short-term therapy, the client often comes back a few months later with another symptom. If it's something like OCD, for example, you'll cure one symptom, they come back, they put it onto another symptom. So it can be more cost effective, but no one will go there and talk about that very much. And long-term therapy treats the issues behind the symptoms. And I think that's always very important. I find that you put a plaster over the symptoms, but you have to understand where they come from, and that does take longer. It also takes time to build trust between the counsellor and the client. And some clients take longer to build that trust with you. So if you've only got a few sessions, you're not going to have the same quality of relationship, and yet research says that the quality of the relationship is the most important part of therapy and what makes it effective, in fact. Some clients take ages before they come to the real presenting issue. They might come with one thing, but it's not really that's bothering them. It's a more holistic approach. And also the benefits of the short-term therapy that I've mentioned can be incorporated into long-term therapy. So although it looks like short-term therapy has more advantages, in reality it doesn't, because long-term therapy includes the advantages of the short-term therapy with the advantages of long-term therapy. The problem is, though, we do not have the resources for long-term therapy. We all have to adjust. And even me, who started and loves long-term work, I've had to adjust to short-term therapy. I've not found that detrimental to my work. I work with it. Young people change. They don't always want to deal with things long-term. They want to pop in and they want to pop out of therapy. And I don't think there's anything wrong with that. The problem that agencies have, though, is that the therapist may change. So if the client comes for a short-term piece of work and they want to continue, they go back on the waiting list, no problem, but then they may have a different therapist, so they have to formulate a different relationship, and that can be problematic for that poor client. There isn't an answer to this because resources in the government are very tight, and they're tight in every single way. With the demands of older people now with social care, young people are not going to get any more. I think we all need to be educators. We all need to do the work at an earlier and earlier age so that we can prevent these complex mental disorders occurring by the age of 14, which is very, very young, isn't it? Thank you very much, everyone.